Hey y'all! Today we're going to be presenting about nursing students and dietetic students at Auburn University partnering to provide lactation cookies to local mothers and mothers visiting the community. My name is Clara Scott. I'm originally from Birmingham, Alabama, and I just graduated from the Auburn University School of Nursing a few weeks ago with my Bachelor's of Science in Nursing. I'm currently studying really hard for my NCLEX and hoping to pass that in the coming weeks and become a registered nurse. And I'm also taking a course which I'm really excited about to learn how to become a certified lactation counselor. I'm hoping that I'll be able to put these skills to use in my new job, and I start this coming week as a labor and delivery nurse at the University of Alabama at Birmingham Hospital.
My name is Mary Isbell. I'm from Fort Payne, Alabama, and I'm a fourth semester nursing student. I'll graduate in May of 2021 with my Bachelor's of Science in Nursing degree.
I'm Ann Lambert. I'm an associate clinical professor here at the School of Nursing in Auburn, and we're just happy to be with you today. So proud of our students joining me and providing you some information about the school and the great things that we have going on here. So some of you have probably visited Auburn before, and for those of you that haven't, we're going to give you a little bit of a tour about the campus and the School of Nursing. So this is a very well-known landmark on campus. This is Sanford Hall, and during the previous years it served as a hospital during the Civil War. So we had some health care going on very early on campus, and I wanted to introduce you to the mission of Auburn. So our goal is to provide education first for our students. Many students and faculty are always participating in and communicating research findings to the community at Auburn and around the world. And then selfless service, which we also call this outreach. And today our talk is really going to focus on this third one here about service or outreach. So let me read a portion of the Auburn Creed. I believe in the human touch, which cultivates sympathy with my fellow men and mutual helpfulness and brings happiness for all. And when I think about that and read that portion of the Auburn Creed, it makes me really think about this is what a nurse does. So the mission of the School of Nursing really directly aligns with the mission of the university. So the mission of our school is to foster and exemplify excellence in teaching, service or outreach, and research. And like I said, we, of course, are educating our students. We're conducting research at the School of Nursing, but we also have a third emphasis on outreach. So let's give you a little bit of a tour of the School of Nursing. We've been here just a few years. We were in a much smaller building right in the central heart of campus. So we've moved out a little bigger and grown a lot in square footage, and we're so happy to have this facility for our students. So this is the entrance here at the front of our building. Sometimes students are out here on the front. When the weather's great, it's a nice place to study and relax. So this is still on the front of the building. This is the inside lobby. So often I see students studying here, sometimes having lunch together here. So we have several spaces for students to study or relax and have social time with each other. This is the back of the building, probably one of my favorite photographs. So just a lovely place. We have labs and classrooms and just a lovely place for students to come for their education. So this is our lecture hall. We have two rooms similar to this. I think we can probably have 120 students here. We often have a mannequin also in the room where we can use the cameras and zoom in to demonstrate or teach about something. So these two girls have spent a lot of time in this classroom. We have about 400 undergraduate students currently in our bachelor's program. This is another area of the building that is for teaching. This is to simulate an examination room like you would see in a doctor's office setting or a community healthcare clinic. We have about 115 master's level students. So it would be very typical for them to be practicing physical assessment and learning additional advanced skills as they study to get their master's degree in nursing. We have two options in that program. You can become a family nurse practitioner, and we also have a nurse educator track, and a lot of our students actually do both of those things. I also wanted to mention to you, we have, for those of you who are already nurses, and you might want to do this or be interested in getting your bachelor's degree from Auburn in nursing, we have an RN to BSN program, and we currently have 6 students in that program. Our newest program is the Doctor of Nursing Practice degree, and we had the first cohort completed their degrees this past December, and we currently have 6 students enrolled in our DNP program. So we have several programs available. We'd love for you to think about continuing your education at Auburn. Okay, so we have a couple of photos of the lab. We have a skills lab. These were our students coming back this fall, and you can see that we are working on masks and shields and social distancing. These students were practicing injections this morning. Here's a couple of more photos where students, and we have high school campers come in the summer who are thinking about being nurses. So on the left here, one of our faculty members is working with a camper to demonstrate venipuncture. The picture on the right, again, is our bed skills lab. These are actually, I bet a lot of you did this in nursing school. We have students brushing each other's teeth, and that's just a rite of passage, you know, as you attend nursing school. The lab is fabulous. We've also considered recently that this area could be used for COVID positive patients as necessary. If the hospital was filled to capacity, there have been some discussions of using our skills lab actually for patients. So that hasn't happened yet. We're glad it hasn't been needed, but it's an extremely nice area.
All right, so I'm going to talk now a little bit about interprofessional education at Auburn, as well as in this project that we did, we collaborated with the dietetic students at Auburn as well. So first of all, I just want to talk a little bit about some of the research that we found about incorporating interprofessional education into a nursing curriculum. And what we found is pretty much what you would imagine, that it's extremely beneficial for nursing students. I know I can speak from personal experience, and I'm sure Mary can as well, that being able to interact with other healthcare specialties in a simulated or in a practice environment before going into the real world and clinicals where you have to do it for real is very, very helpful for understanding the scope of practice of other individuals, as well as just how to communicate with others on a healthcare team. So first, I'm going to talk about our interprofessional education clinics. And here you can see a picture of one of our clinics taking place. You can see that we have a nursing student here, and then also pictured we have a dietetic student, a student from the social work program, a pharmacy student, as well as a VCOM student. And VCOM is our Edward Via College of Osteopathic Medicine. So these students are training to become DOs in the future. And so you can see that we've got a lot of specialties here at the table. And in this picture, this is actually a clinic that I also participated in. These individuals are working to help this sweet lady here, and they're working on a medication reconciliation as well as looking at her healthcare history. They're trying to find any sort of gaps in her care or any sort of needs that that she has to be met. And so during these clinics, we're able to take blood pressures, look at basic vital signs, as well as draw blood glucoses to look at HbA1cs, as well as cholesterol levels and different simple labs like that to help look at a person's overall health picture. This is a really neat opportunity. And so what the students here are doing is they're talking to this woman to find those gaps in her care, like I mentioned, and then they will go in turn collaborate with their professors. So this group will get together and speak about the needs that they see that they feel like they can provide for her. And then they'll go and talk to their professors from the DO school, from pharmacy, social work, dietetics, and nursing. And they'll come up with a plan to provide actual care for this patient. I know in some of my simulated situations, we were even able to call a pharmacy where a patient was getting their medications because their dementia was more advanced. And so they were unable to keep track of their medications. And so we were able to call their actual pharmacy and get that straight for them. So this is one of those great examples of bridging the practice to a real life scenario to be able to help others. These are other pictures from some of our IPE clinics. And so again, on the left, you see a dietetics student, a VCOM student, as well as a nursing student collaborating to come up with a care plan for their patient. And the same thing is happening over on the right as well. So this is a picture of our active learning classroom in the School of Nursing. And this classroom is able, you can kind of see down the middle, there's this line across the ceiling. And so from that comes down this partition. So the room can be separated into two halves if needed. But you'll see that there's lots of glass whiteboards, movable chairs and tables, podiums, and then there's TV screens by every little desk along the wall. And so this is a great space that we use a lot in class for group work, where we can put up presentations or different group projects that we're working on, or you can see the lecture being presented at the TV right in front of you. But this is a picture from one of our interprofessional collaboration seminars. And so in these seminars, we get together with, again, many of the specialties mentioned before, and this is a great space to be able to work on team building skills, healthcare ethics skills and activities, but most importantly, to kind of learn about each other's profession and learn about the scope of practice. I know for me, I didn't realize all the different things that pharmacists could do or social workers. And so this is a great space for me to be able to learn from others and hear what their scope of practice would be and how I could rely on these professions in my future practice to help provide the best care for my patients. So pictured here, we have a few other interprofessional collaboration opportunities. On the left, we have one. This is our Pediatric Skills Day. And this is takes place every semester for our second semester nursing students. These second semester nursing students are going into their medical surgical nursing class as well as their pharmacology class. And so they're about to get their first dose of pediatrics and do their first pediatric clinicals. This Pediatric Skills Day provides just a great time for nursing students to be able to collaborate with healthy, normal, well children from about preschool age, a few on upwards. And in this activity, they're able to, again, collaborate and learn about these healthy children so that when they're in the healthcare setting and they're taking care of a 3-year-old, they understand the differences between a normal, healthy 3-year-old and a sick 3-year-old in the hospital. And so they're able to understand, how can I convince this child to take the medications that they need or whatever that it may be. In this scenario, we also have students from our College of Human Sciences on Auburn's campus. And these students are majors in human development and family studies, which is a major that many people go into before becoming child life specialist. And so they're also there to be able to help out and play and interact with these children as well, which is really neat. And then over on the right is one of our very unique experiences. This is our disaster simulation. So every year, COVID allowing, we have this simulation. Didn't happen this year, but it's usually in the spring. And the students from the VCOM medical school and then the nursing school will get together, and we have simulated patients. We have some patient actors that have like stage makeup on to show traumatic injuries or burns or wounds. And basically we simulate a mass casualty incident. So I believe the last time they did it, it was a major train wreck. And we had these patients coming in where students had to learn how to triage these patients and provide basic care in the field. And then they would transport many of these students upstairs to the hospital setting where you saw the pictures of our skills lab beforehand. And so alongside with professors, they're able to learn how to triage patients and care for patients in a disaster and mass casualty situation. Over here on the right, we have a picture of a game that recently some of our nursing and pharmacy students played together. And so they called it A Night in the ER. And basically this game was made up as a way for students to, again, collaborate with each other and learn about how to manage patient care, triage patients, and manage beds and the flow of beds in the hospital, which is really important. So again, great teamwork and collaboration skills. And then over on the right, we have a picture of one of our beloved professors, Dr. Pope, and he runs, along with another professor, our animal-assisted therapy program. So this is one of our therapy dogs here. We actually have a room in our School of Nursing building. That's something that was specially built in for our dogs, where they can stay throughout the day. They're great stress relief between classes, but more importantly, students are able to go with Dr. Pope and other professors to take these dogs into nursing homes in areas that need animal-assisted therapy, as well as to other colleges on campus to collaborate with other students. Another opportunity that I want to mention is something I participated in this spring when COVID hit and we had to go home and leave campus, but we still had a Zoom clinical scenario. I was placed in one with speech and language pathology graduate students on Auburn's campus. And so again, just another really great situation where I was able to learn from other students and learn about their scope of practice and how I could utilize their services in the future for my future patients.
So the School of Nursing was able to start the Tiger Babies tent in 2015. The tent is up at football games, but we also provide services at basketball, softball, and gymnastics. The tent just serves as an area for breastfeeding mothers to come and feed their infant in a clean and private area. And then also we have face painting and coloring and different fun activities for any older kids that the mothers might have that they need something to entertain their other child with while they're feeding. We also have a changing table set up for these moms and just an area of like peace and quiet for a little bit if they need a snack or need something to drink. Since 2015, we have had over 1,000 mothers come to our tent and use our facility. And we also have a certified lactation consultant at our tent at football games. So this is a picture of Bruce Pearl with 2 of our students at a softball game. So when you come into the softball game, the students are standing there holding up their sign, and we have pamphlets talking about what we do and what the services that we provide. And then this is a picture of the tent that we set up outside of the football games. And then this is a picture of the tent at a football game. This is a mother and her baby. In the background, you can see our changing station that we have set up. And if you look, you can tell we have a drape set up that the mothers can go in there, and it just offers a private area for them to breastfeed. And then in this picture on the left, that is one of our pods. So we were able to raise money to buy the first pod through Tiger Giving Day. So we bought the first pod with that, and then nursing alumni raised the money to buy our second pod. And in these, usually one mother can go in there and breastfeed their child in a clean and private area. And then on the right side, you can see we have a student standing there holding up that same sign at the first aid station, and there it also just offers a private area for mothers to go and feed their child or get some peace and quiet or change a diaper or whatever they need to do. So this is a map showing where we have had mothers come and use our facility. So we've had mothers from each of these states come to use our facilities at either football or gymnastics or softball or basketball. So these are some statistics about breastfeeding in Alabama. 63.1% of mothers in Alabama have ever breastfed. And then at 3 months, only 34.1% of those mothers exclusively breastfeed. And then on to 6 months, only 20.6% of those mothers exclusively breastfeed.
Okay, so here is an example of the recipe that the Student Dietetic Association at Auburn came up with. And these are this is the recipe that they use to make the cookies and hand out at our Tiger Babies tent. You can see here, it looks delicious. It's got a lot of really good nutrients in it, as well as it's just a fun snack for moms. So we're just going to talk a little bit about the benefits of some of these ingredients. So the flaxseed contains lots of omega-3s. The wheat germ contains zinc. The brewer's yeast contains protein, iron, B vitamins, and other essential minerals. The oats contain fiber and complex carbohydrates as well. So the importance of these ingredients. So basically through our research, we found that brewer's yeast, flax, and oats are considered to be galactagogues. And galactagogues, that's a substance that promotes breast milk production. So what we found in the research is that galactagogues may or may not increase milk production. That, as you can see from this previous slide, the ingredients that are considered to be galactagogues also contain lots of really beneficial proteins, vitamins, and minerals that a mom needs to, first of all, heal in the postpartum period, but to also nourish her body as her body is prioritizing feeding her child. And here you can see some pictures of the Student Dietetic Association working to make those yummy lactation cookies that they handed out at the Tiger Babies tent.
So after we were able to give these cookies to some of the Tiger Baby moms, we were able to survey them, and some moms did report an increase in milk supply. And then a lot of the moms just said they were a tasty treat to have. And then we were able to provide a recipe that our dietetic students made in a pamphlet, and then we were able to hand those out to each of the mothers. So if they wanted to, they could go home and make them on their own. We did have some limitations during this project. We had quite a few scheduling conflicts between nursing students and dietetic students. We were able to have nursing students at the tent when we were handing these out at the football games, but sadly we did not get to have any dietetic students there due to scheduling conflicts. And then also, Clara kind of said this, but we did have some problems looking for research about galactagogues and their effect on breast milk supply. But they're not for sure going to increase the milk supply, but they're just good nutrients for the mother and for the baby. And more research needs to be done about the effects. In the future, we plan to provide lactation cookies at basketball games. And then we hope to have nursing students collaborate with the dietetic students to actually make those cookies and then them go and hand them out at different events. And then this was actually supposed to happen in March, but because of COVID, it didn't get to happen. But nursing students are planning to collaborate with Baby Steps, which is a thing that Auburn offers for expecting mothers and mothers with young kids that are going through college. We plan to collaborate with the Student Dietetic Association to provide lactation cookies to those mothers and educate them about the benefits. These are our references. And then we just want to say thank you for listening to our presentation. And then if there are any further questions, you can contact Dr. Lambert.
So thank you. We enjoyed being with you. And again, just hope we've told you something new about our partnerships. As you can see, we do quite a bit of interprofessional education with our nursing students and introducing them to the other disciplines of people who they're going to be working with these people when they finish school and start their first job. So we hope we've interested you in that and our lactation cookies. That was a great outreach project. And thank you to Clara and Mary for a great job. Thank you.
Thank y'all so much.